A headache strikes without warning, peaks in seconds, and feels unlike anything you have ever experienced in your entire life before. Most people dismiss it as stress or fatigue, but what if that single moment was your body screaming a neurological emergency? Stay with me, because what I am about to reveal could be the difference between life and a tragedy you never saw coming today. Headaches are incredibly common, especially as we get older, but not all headaches are created equal in terms of danger or risk. After age 50, any new or dramatically different headache must be treated as a potential warning sign of something very serious. Research shows that conditions like brain aneurysms, strokes, and artery inflammation occur far more often in adults over 55. These are not the dull, predictable headaches you may have lived with for years, but sudden, severe, and completely unexpected attacks. What makes certain headaches so dangerous that doctors call them red flags and rush patients straight into emergency diagnostic testing? Why do some headaches disappear on their own, yet still signal that a catastrophic event is just hours or days away from happening? I am going to answer every one of these questions in detail, and by the end, you will know exactly when to seek help. Please leave a comment below telling me where in the world you are watching this video from. I always love hearing from you. Your brain sits inside your skull, surrounded by fluid and a network of blood vessels that supply oxygen and nutrients constantly. When something goes wrong with those vessels, like a tear, a rupture, or severe inflammation, the pain can be immediate and intense. Think of your blood vessels like the water pipes in your home. When a pipe bursts, the damage spreads fast and needs urgent repair. Conditions like subarachnoid hemorrhage happen when an aneurysm, a weak bulge in a vessel wall, suddenly ruptures and bleeds into the brain. Giant cell arteritis is an inflammation of the arteries in your temples and scalp, and it almost exclusively affects people over 50 years old. Both of these conditions can cause permanent damage or death if not treated within hours, yet their early symptoms are often ignored completely. Now, I want you to pay very close attention, because I'm about to walk you through 7 warning signs that you must never ignore. These are the red flags that separate a common headache from a true neurological emergency that demands immediate medical attention right now. Warning sign number 1, the headache that comes out of nowhere and reaches maximum intensity in less than 60 seconds or even faster. Doctors call this a thunderclap headache, and it is one of the most dangerous headache patterns known to medicine and emergency neurology worldwide. It feels like being struck by lightning inside your head, and the pain is so sudden and severe that people often collapse or cry out. This type of headache is strongly associated with subarachnoid hemorrhage, which means bleeding around the brain from a ruptured aneurysm or torn vessel. Studies show that up to 45% of people who suffer a subarachnoid hemorrhage do not survive, and many who do face permanent disability. The thunderclap headache can also signal arterial dissection, where the inner lining of a blood vessel tears and blood flows between the layers. Reversible cerebral vasoconstriction syndrome is another cause, where blood vessels in the brain suddenly tighten and then relax, causing intense pain repeatedly. If you or anyone around you experiences a headache that explodes in intensity within seconds, do not wait or try to sleep it off. Call emergency services immediately, because every minute counts when it comes to diagnosing and treating bleeding or vascular damage in the brain tissue. Do not drive yourself to the hospital, do not take pain medication and hope it goes away, and do not assume it is just a bad migraine. Emergency doctors will perform imaging tests like a CT scan or MRI to look for blood or other abnormalities that require urgent surgical intervention. The faster you act, the better your chances of survival and full recovery without lasting brain damage or cognitive impairment afterward. Many people who ignored this warning sign later said they thought it was just stress, but stress does not cause sudden explosive head pain. Remember, a thunderclap headache is a medical emergency, and it should always be treated as such without any hesitation or delay whatsoever. This is the kind of headache that should send you straight to the emergency room, no matter what time of day or night it happens. Warning sign number 2, the worst headache of your entire life, qualitatively different from anything you have ever felt before in the past. This is not just a bad headache, it is a headache that feels completely unlike your usual tension headaches or even your worst migraines. Neurologists use the phrase worst headache of life as a key diagnostic clue for subarachnoid hemorrhage and other life-threatening brain conditions. Patients often describe it as feeling like their head is exploding or like someone is hitting them with a hammer from the inside repeatedly. Even if you have suffered from migraines for decades, this headache will feel fundamentally different in quality, location, and sheer overwhelming intensity. Research published in emergency medicine journals shows that this description is so specific that doctors take it very seriously as a red flag. If you find yourself saying, "I have never felt anything like this before," that is your body telling you something is seriously wrong inside. Do not minimize it. Do not wait to see if it improves. and do not assume it is just a really bad version of your usual headache. The worst headache of your life is a cardinal symptom of bleeding in the brain, and it requires immediate emergency evaluation and imaging. Many survivors of brain hemorrhages recall that they knew instantly something was terribly wrong, even if they could not explain what it was exactly. Trust your instincts, and if a headache feels fundamentally different and unbearable, seek emergency care without delay or second-guessing yourself at all. Emergency rooms are equipped to perform rapid imaging and blood tests to rule out or confirm bleeding, aneurysm, or other vascular emergencies quickly. Remember, it is always better to be evaluated and reassured than to ignore a warning sign that could cost you your life or independence. This is especially true for people over 55 because the risk of serious secondary headaches increases significantly with age and vascular health. Never feel embarrassed about seeking help for a headache that feels like the worst you have ever experienced, because it might truly be an emergency. Warning sign number 3. A headache accompanied by neurological signs like weakness, numbness, slurred speech, vision changes, or facial drooping suddenly. When a headache comes with these symptoms, it is a strong indication that something is affecting the brain directly, not just the blood vessels. Weakness on one side of your body, difficulty speaking clearly, or sudden loss of coordination are classic signs of a stroke or brain hemorrhage. Vision changes can include blurred vision, double vision, partial loss of vision, or seeing flashing lights that were not there before the headache. Facial drooping, where one side of your face appears to sag or you cannot smile evenly, is another critical warning sign of a stroke. Confusion, difficulty understanding speech, or sudden memory problems are also red flags that the brain is not getting enough oxygen or is under pressure. Seizures that occur with a headache can indicate bleeding, a tumor, or severe swelling inside the brain that needs immediate medical intervention now. These neurological signs mean that the brain is being damaged in real time, and every minute without treatment increases the risk of permanent injury. Strokes and brain hemorrhages are time-sensitive emergencies, and doctors often say, "Time is brain," because brain cells die quickly without oxygen supply. If you or someone you know develops any of these symptoms along with a headache, call emergency services immediately without waiting or hesitating. Do not try to drive yourself, do not wait to see if the symptoms improve, and do not assume it will pass on its own. Emergency responders and hospital teams are trained to recognize and treat strokes and hemorrhages fast, using clot-busting drugs or surgery when needed urgently. The faster you act, the better the outcome, and many stroke patients who receive treatment within hours make a full or near-full recovery. Remember, a headache plus neurological symptoms is never normal, and it always requires emergency evaluation without any delay or second thoughts at all. Warning sign number 4. A headache accompanied by fever, stiff neck, and sensitivity to light, which is the classic triad of meningitis or encephalitis. Meningitis is an infection or inflammation of the protective membranes covering the brain and spinal cord, and it can be caused by bacteria or viruses. Encephalitis is inflammation of the brain itself, and both conditions are medical emergencies that can cause death or permanent brain damage if untreated quickly. A stiff neck means you cannot bend your neck forward comfortably, and trying to touch your chin to your chest causes severe pain or resistance. Sensitivity to light, called photophobia, makes it painful or uncomfortable to look at bright lights or even normal indoor lighting in your home. Fever with these symptoms means your body is fighting an infection, and the infection may have reached the central nervous system and brain tissue. Other symptoms can include nausea, vomiting, confusion, drowsiness, and difficulty waking up, all of which indicate serious brain involvement and danger. Meningitis can progress very rapidly, sometimes within hours, and without treatment it can lead to seizures, coma, and death in a short time. Bacterial meningitis is especially dangerous and requires immediate intravenous antibiotics to stop the infection from spreading further in the brain and body. If you develop a headache with fever, stiff neck, and light sensitivity, go to the emergency room immediately or call an ambulance right away. Do not wait until the next day to see your regular doctor, because meningitis does not wait, and every hour of delay increases the risk. Doctors will perform a lumbar puncture, also called a spinal tap, to test the fluid around your brain and spinal cord for signs of infection. Early treatment with antibiotics and supportive care can save your life and prevent complications like hearing loss, brain damage, or limb amputation. This triad of symptoms is one of the most serious headache patterns you can experience, and it should always be treated as a medical emergency. Warning sign number 5. A new, persistent headache appearing after age 50, especially over the temples, with scalp tenderness or jaw pain when chewing. This is a classic presentation of giant cell arteritis, also called temporal arteritis, which is an inflammation of the arteries in your head and neck. Giant cell arteritis occurs almost exclusively in adults over 50 years old and the risk increases significantly with age, especially after 65 years. The condition affects about 20 out of every 100,000 older adults, making it the most common vasculitis in this age group worldwide. The headache is usually new, meaning it is not something you have experienced before, and it is often described as throbbing or aching over the temples. Scalp tenderness means that brushing your hair, resting your head on a pillow, or even touching your scalp causes pain or discomfort that is unusual. Jaw pain when chewing, called jaw claudication, happens because the inflamed arteries cannot supply enough blood to the jaw muscles during eating or talking. Some people also experience transient vision loss, where their vision goes dark or blurry for a few seconds or minutes and then returns to normal. This transient vision loss is a major warning sign because giant cell arteritis can cause permanent, irreversible blindness if not treated within days or hours. Studies show that 70 to 80% of people with giant cell arteritis have a headache as one of their main symptoms at diagnosis time. The condition is often mistaken for migraines, tension headaches, or dental problems, which delays diagnosis and increases the risk of vision loss significantly. If you are over 50 and develop a new headache with any of these symptoms, see a doctor immediately and ask about giant cell arteritis. Doctors will order blood tests called ESR and CRP to check for inflammation, and they may perform a temporal artery biopsy to confirm the diagnosis. Treatment with high-dose steroids must begin immediately, often before the biopsy results are even available, to prevent blindness and other complications quickly. Warning sign number 6, a headache triggered or sharply worsened by exertion, coughing, sneezing, bending over, or sexual activity without any warning. This pattern suggests that something is increasing the pressure inside your skull, or that a blood vessel is being stressed in a way that causes pain. Exertional headaches can be caused by increased intracranial pressure from conditions like brain tumors, bleeding, or blockages in the fluid drainage system inside the skull. They can also be caused by vascular problems, where a blood vessel expands or contracts suddenly in response to physical strain or pressure changes. Cough headaches are a specific type, where the act of coughing, sneezing, or straining during a bowel movement triggers a sudden sharp headache immediately. These headaches are usually brief, lasting seconds to minutes, but they can be a sign of structural problems like a Chiari malformation or a brain tumor. Sexual activity headaches, also called coital headaches, can occur during or after intercourse and may indicate vascular issues or increased intracranial pressure buildup. While some exertional headaches are benign and not dangerous, any new-onset exertional headache after age 50 should be evaluated by a doctor promptly. Doctors will typically order imaging tests like an MRI to look for tumors, bleeding, or structural abnormalities that could be causing the pressure or pain. If the imaging is normal, the headache may be classified as primary exertional headache, which is less dangerous but still requires monitoring and management. However, if imaging shows a tumor, bleeding, or other abnormality, treatment may include surgery, medication, or other interventions depending on the cause found. Never assume that a headache triggered by physical activity is just a normal response to exertion, especially if it is new or severe. Keep track of when the headache occurs, what triggers it, and how long it lasts, and share this information with your doctor during your visit. Early diagnosis and treatment of the underlying cause can prevent serious complications and improve your quality of life significantly over time and with care. Warning sign number 7, and this is the most surprising and dangerous of all: the sentinel headache, a sudden severe headache that resolves on its own. This is the headache that tricks you into thinking everything is fine because the pain goes away after minutes, hours, or a day or two. A sentinel headache is often a small warning leak from a brain aneurysm, a weak bulge in a blood vessel that is about to rupture completely. Research shows that up to 43% of people who suffer a major subarachnoid hemorrhage had a sentinel headache days or weeks before the catastrophic bleed. Some systematic reviews report that between 15 and 60% of patients recall having a sudden severe headache that resolved before the major rupture occurred. The problem is that because the headache goes away, people dismiss it as stress dehydration or just a random bad headache that does not need attention. But that temporary headache was your brain giving you a critical warning that a blood vessel is damaged and leaking, and a major rupture is coming soon. When the aneurysm finally ruptures completely, the bleeding is often massive, and the mortality rate is as high as 45% according to medical literature. Many survivors of subarachnoid hemorrhage later recall that they had a sudden, severe headache days or weeks earlier that they ignored because it went away quickly. This is why doctors emphasize that any sudden, severe headache, even if it resolves on its own, should be evaluated immediately with imaging and medical tests. Do not assume that because the pain is gone, the danger is gone too, because the aneurysm is still there and the risk of rupture is extremely high. A CT scan or MRI can detect even small amounts of blood or a bulging aneurysm before it ruptures completely, allowing doctors to intervene and prevent disaster. If the aneurysm is found early, it can be treated with surgery or endovascular coiling to prevent a rupture that could be fatal or cause severe disability. This is the most surprising warning sign because the headache disappears, giving false reassurance. Yet the underlying danger is still present and growing every day. Now that you know the 7 warning signs, let me give you practical steps to protect yourself and your loved ones from these dangerous headaches. First, keep a simple headache log where you write down when the headache started, how severe it was, what it felt like, and any other symptoms. Use the first or worst rule. Any first ever severe headache or the worst headache of your life should send you to the emergency room immediately. Never normalize a new headache after age 50, especially if it is different from anything you have experienced before or comes with other symptoms. It is important to mention that not every severe headache is a medical emergency, and some people do have benign exertional or primary headaches. However, if you have any of the 7 warning signs I described, do not refuse imaging tests or blood work out of fear or convenience. Thank you so much for watching and taking the time to learn about these critical warning signs that could save your life or someone you love. Please like this video, share it with friends and family who are over 55, and leave a comment telling me your thoughts or experiences. Please like this video, share it with friends and family who are over 55, and leave a comment telling me your thoughts or experiences.